So thank you to all of you guys who've listened to every single presentation today and for sticking around to listen to mine because it is 15 minutes long and I do try to cover 3 papers in it. Because this presentation is going to briefly overview my work that has focused on addressing the understudied floods and health access nexus. So just to give an overview, I'm going to start by just briefly discussing my master's work, which resulted in a novel methodology, coupling flood models with health access models in order to be able to assess the impacts of floods to maternal health access. And then I'll move on to discuss the work of my PhD, where I've built upon that methodology and the conclusions to assess how climate change is going to affect floods and how that will then impact health access in the future as a result. So for any of you that are not aware, because I'm aware this is a very floods-oriented audience, health access models are a really important tool that are used to measure travel times in their most basic form. And they're critical because they help identify vulnerable populations. So they're quite important for health officials to identify inequitable health access. They're commonly created using geographic information systems because you can combine multiple variables that are barriers to health access, such as distance and topography. But floods, crucially, have just never really been included in these in the Global South. They're well known in the literature, floods, to cause morbidity and mortality because emergencies that were preventable in the dry season become, unfortunately, fatal in the wet season when people can't access care or when health officials can't maintain medical supply chains or make emergency referrals. So they've not been addressed in health access models, despite how important they are. And what you can see on the figure here is kind of, at most, health access models present a best access scenario. So there's no consideration of floods at all. And the few that have tried to have either just relied on generic flood extents that don't actually correlate to any known flood, or they just kind of reduce the parameters. And what you can see here is you've got tons of missing information. When are the floods actually beginning to impact health access? When do the floods stop impacting health access? And we all know that floods are so variable depending on where you are. They change through space and time. So we need to be able to assess them properly. And this was kind of the rationale for me to develop a framework that would permit this new understanding, especially because obviously we're all concerned about climate change, which will affect floods. And at the minute, we don't know how floods are even affecting health access. So how can we prepare for the future climatic impacts? So I don't want to delve too much into methods because I'm personally not a fan of that in presentations, but if you are interested, I have published this paper that goes into detail, and if you're super interested, there's a whole thesis on it. But essentially, what I've done is I've just taken a flood model and integrated them into common health access models already used in the Global South by practitioners and researchers. So the first methodology is network analysis, and this is normally used to just kind of model in maternal health referrals between delivery sites and emergency obstetric care centres, which is where women get emergency treatment. And then the second is cost distance algorithms or kind of raster models. And these are used to model the ability of women to walk or boat or to use any kind of transport or a combination of transport to access different health facilities. So I will now go on to talking about the case study application, but I really want to emphasize that this framework is very generalizable and I do want to see it applied to other regions. And there's a few projects that have started to do that. Because for me as well, when developing this framework, the importance was to use the health models that are actually being used at the minute, but to make sure that when we capture the influence of floodwaters, we're not substantially inflating data requirements that can't be applied to regions without necessary data, and that they don't have inappropriate assumptions. So for me, that meant really working with the local people there to make sure that I was aware of the local transport and the health access situation in the location. So the case study was the Mroz floodplain in Zambia. If anyone's been there, it's absolutely stunning, would recommend it. And it has these extensive floods that persist between typically February and June. And there is a high annual variability to be expected in those floodwaters. And there's about 44,600 people that live on this floodplain because the floodplain provides these incredible ecosystem services to their livelihoods. But despite those positives, there are also negatives. And health officials flagged to us that they were really concerned about the impacts of floods on health access, because the local people are already walking very long distances to healthcare, and that gets worsened in floods when their typical access routes are cut off. And the health officials have also experienced issues in maintaining medical supply chains and making emergency referrals. And for them, I don't know if you can see it on the slide, there's a slide here that says, no woman should die giving life, because at the minute in this region, they want to completely eradicate maternal mortalities. And unfortunately, they're remaining high because of the floodwaters, because they can't get access to the women and the women can't reach them. So in brief, just to kind of give a brief overview of methods, I took data wherever possible from national data sources, but also relied on some open access and freely available global data sets. The floods data came from Leeds FP, which was run by a colleague of mine, Tom Willis, and they were rastered the floodwaters for 13 months between October 2017 and October 2018. So that's the health access model and the flood model in brief. From that, I then wanted to model women's ability to reach delivery sites, emergency obstetric care, and then maternity waiting shelters, which is places that women wait to give birth. To do this, I used the two techniques as previously described. So if you remember this figure, this is modified, as I mentioned, from my paper. And when we actually now put a flood model into a health access model, as you can see in this GIF, we are getting way more detail than we've ever seen before. We are seeing the floods move across the floodplain and affect access. With the framework, we're essentially unlocking that granularity of spatial and temporal changes. So we can actually see that the floods first impact health access in December 2017. The peak originates in March 2018. But actually, the floods continue to impact access from June 2018 to actually up to October 2018. And this is because whilst the 2018 floods were within the normal interannual variability, they were still quite large by comparison. And I think the key message here is that the previous static approaches would have completely missed a key observation that if we think of October as the dry season, and they were saying the best access is in the dry season, well, in 2018, that wasn't the case. Oops, gone too far. And another just brief point to make, I couldn't fit all my results on the slides because I would have run out of time. But if you looked at Calabo there, signposted on the map, you can see a little kind of floodplain there that inundates for probably the longest period of time. And what we found was that access to emergency obstetric care was impacted earliest, and an entire population located there lacked access for the majority of the year. And that was because there's only one hospital located in Calabo, and they have a pinch point, essentially, this kind of one transport route that when the floods inundate it, they're cut off for the majority of time. And because of this approach, we could then flag that to health officials so that they can address this problem. And this is just the results of the network model. So referrals, there's a common concept known as the golden hour, which refers to the ability of women from the onset of complications while giving birth to receive health assistance before, unfortunately, they pass away. So that's the green colour. So where we see green, that's good. Where we see grey, that's pretty terrible, because it means the women are actually able to be referred to hospitals where they can receive treatment. So essentially, we just see the same pattern as the flood progress. Access is impacted, and this matching the quotes that we received from health officials where they're saying when they're doing maternal death reviews, the majority are due to these delays because of the floods. So moving on to now the work of my PhD, I'm now wanting to understand how climate change will impact the floods of the region, and then by extension, how that will impact health access. And the methodology I've just described has now allowed this door to be opened and explored, because when we have flood models, as we all know, we can simulate extreme events and long-term climate change can be modelled. And this area, again, the impacts of climate change to health access is completely understudied. Most work that have looked at climate change and health focus on the impacts of increasing temperatures, not floods. So just in the study region, the Zambezi Basin is one of the most threatened in Africa because the minor changes in rainfall have non-linear impacts to the discharge. And again, from interviews with local people and health officials, they're observing the impacts of climate change, not in the future, but now already. They're seeing that the pattern of flooding is changing beyond what they know. They can't predict the floods anymore with their Indigenous knowledge. It's causing drought and hunger. And we're seeing that people are not necessarily going to health services anymore, and institutional deliveries are being affected. So to just assess the impacts of climate change, or to do the climate change floods model bit, I took 5 CMIP 6 GCMs from the ISIMIP database, which are meant to be representative of the entire CMIP ensemble. I modelled a baselines decade and 3 future decades representative of the near, mid and far future, the 3 future scenarios. These were used as inputs to 5 hydrological models representative of each subcatchment of the Mroz, because there's quite a few tributary inflows. And the discharge outputs from the hydrological models were used into the Liz flood FP flood model again. And I assessed the flood characteristics of rise, recession, duration, and peak to see how these would change in the future. And this work is currently in prep. As you can all probably relate to, when I can be bothered to do the revisions, it will go into press, hopefully. The results show increased aridity in the Mroz floodplain, which unfortunately becomes significant in the mid to far future. And the reason behind this is because the timings of flood rise and flood recession are altering. So rise is occurring later in the year and recession is occurring earlier, which consequently results in declines in flood duration and declines in flood magnitude. On the left here, we've got the outputs for every single future scenario compared to the baseline decade. So on the left is flood duration declines, and you can see swathes of orange, which refer to multiple months of the floodplain now no longer inundates in a particular year. And then on the right, we have the flood frequency or magnitude declines. And where you see particularly dark red, those are areas of the floodplain that will just cease to inundate in the future compared to what has been observed historically. So this next work is what I now need to start doing, which is basically putting the outputs of those flood models into health access models. But I've already got some working hypotheses, which is essentially when people back in the UK ask me about my work, they hear about the floods declining and think that's great. They think that's going to assist access. They think that's going to help the health situation. Because in the UK and probably in the West, we see floods as disasters, but here the local livelihoods are oriented around those floods. And actually it's these variations beyond what have been observed historically that we really need to be concerned about, because these populations use their Indigenous knowledge to kind of get building materials, to do agriculture, and they can't predict them anymore. So how can they live their livelihoods with the floods anymore? And this is why it's just really important when we work in these regions to make sure we're putting seasonal floods in the context of their localities. So yes, these populations are becoming vulnerable to shocks, which is of great concern for making sure that we're resilient to climate change impacts on health, which is obviously a sustainable development goal as well. And then finally, one of the reasons why they're quite vulnerable is that they rely on boats a lot to travel around when the floodwaters are kind of open. And this, again, in health access models, boats have been occasionally documented but not incorporated. So my future work now will be, or my work has now implemented boats into health access models, so I can kind of assess the difference it makes when you compare just walking access with a kind of combined multimodal transport health access model. So just to summarize, flood models and health access models are utilized extensively, but they've never been coupled, which my work now has done so that we can assess for the first time flood impacts on health access. There's clearly great potential for generating predictive methods that will be necessary to consider climate change impacts, but also to maybe consider early warning systems, kind of extreme what-if scenarios. And I'm very hopeful that other people will take up on this. And I'd really like to finalize the point that interdisciplinary teams are the best addressed to kind of address complex societal flood challenges, because I don't work alone. I work with an immense amount of hydrologists, flood modelers, biologists, anthropologists, and health access experts. And I'm also very grateful to all of the SAMBEAN organisations that have assisted me. so warmer, and actually the local government of the floodplain has really assisted me in developing this to address their needs. If you're interested, there's a paper there that does the first half of the Masters. There's an unpublished paper there with a title that will not change, hopefully, and my email if you're interested in discussing this further or speak to me afterwards. Thank you.